Vegetarians are prone to develop anemia, especially iron deficiency anemia. Hi everyone, I'm Dr. Sivakumar Palaniappan. I am a clinical consultant hematologist. I'm a resident doctor working at Pantai Hospital, Kuala Lumpur. So today, we're going to answer some commonly asked questions about hematology. So let's hit the questions. First question, what's hematology? So basically, hematology is the study of blood-related disorders ranging from benign right up to malignant conditions. Benign hematology conditions such as anemia, as well as reduce in platelet counts, and then ranging from bone marrow disorders such as leukemia and also other related blood disorders, malignant blood disorders such as lymphoma. And we also have other hematological conditions such as bleeding disorders and also clotting disorders. We basically cover a range of blood-related disorders. Can anemia be fully reversed with treatment? There are quite a lot of conditions where anemia can fully be reversed with appropriate treatment. For example, iron deficiency anemia, when we have corrected with proper diet control, iron tablets, IV iron, and also identifying what's the cause of the iron deficiency anemia, the anemia can be fully reversed. However, we also have other conditions that can cause anemia, such as B12 deficiency, where we have to identify what is the underlying problem that causes this condition, and then we can actually correct the anemia. However, there are also other chronic anemic conditions that require prolonged treatment to actually correct the anemia. Why do some people have the urge to chew ice, especially if they are anemic? The tendency or the urge to chew ice is relatively or commonly termed as pica. So patients with iron deficiency anemia, they have this tendency to chew ice. We're not sure what's the exact mechanism in this condition. However, we feel that it could be because ice can help to soothe the inflammation most patients with iron deficiency anemia experience. Do women have a higher risk of anemia due to menstruation? Yes, women tend to become anemic during menstruation, especially if they have prolonged menstruation or heavy menstruation, as described as menorrhagia. And this eventually leads to iron deficiency. So therefore, we do encourage women, especially those who are having very heavy menstrual cycle or having very heavy periods, to basically get it checked and take iron-rich food. Are vegetarians more prone to developing anemia? Yes, vegetarians are prone to develop anemia, especially iron deficiency anemia. That's because they tend to take more plant-based source of diet, and that does not help in the absorption as much as a animal source of iron. We do encourage vegetarians to concentrate on food that are rich in iron, for example, lentils, beans. We do encourage them to take iron supplements as well. Is leukemia hereditary? So leukemia is not inherited. However, patients who are having family history of leukemia, you tend to run an increased risk of developing any form of leukemia. There are certain genetic conditions, for example, Down syndrome actually increases the risk of developing leukemia. However, we have noticed there is most of our patients who have been diagnosed with leukemia not to have any family history of blood-related cancer or disorders. Which is more severe, leukemia or lymphoma? The severity of either leukemia or lymphoma basically depends on the type, the subtype, and also the stage of the disease when at diagnosis. But there are some leukemias and lymphomas that are extremely aggressive and can be life-threatening. Consulting a clinical consultant, hematologist, and also early diagnosis is very important in order to treat the disease accordingly. How does a bone marrow transplant work as a treatment for leukemia? Basically, by doing a bone marrow transplant, we are basically trying to treat the diseased marrow with a new set of stem cells, basically trying to cure the underlying leukemia or lymphoma. Therefore, getting the patient into a remission. Do all lumps and bumps indicate lymphoma, or could they be harmless? So it's important to identify these lumps and bumps because not all are actually harmful. Some can be harmless, some can be due to infection, some form of inflammation or non-cancerous condition. If these lumps do persist despite receiving treatment, these things has to be investigated, especially if there are other compounding symptoms that comes together. For example, prolonged fever, weight loss, loss of appetite, and other constitutional symptoms. So that has to be checked and investigated properly. If you have any other blood-related questions, please do leave your questions at the comments below. Thank you.